So welcome everyone. Thank you so much for being here. Today's webinar is going to focus on health literacy and young adults, and we're so glad to have you here and also have the recording for those who'd like to view it later. So what our plan is today is we're going to define and describe health literacy. That's where I'm going to start out with. And then we're going to have a panel that's going to look at exploring health literacy efforts in various community contexts with a focus on young adults. And we hope that the takeaways are some evidence-based practical approaches to help build capacity for health literacy work with a focus on public and school libraries and assisting librarians in combating the proliferation of health misinformation. So again, we'll be featuring a panel of experts who will be talking about how to provide insight and recommendations to equip public and school librarians with the information and tools that they need. Just to provide some introduction to the topic, we believe that information professionals are uniquely positioned to advocate for health literacy in a variety of ways. One is to advocate for easy to read materials, so having information out there that people can engage with and understand, as well as design and deliver information literacy instruction. So this is something librarians do day in and day out, and we can apply it to a health context as well. We also believe that public and school librarians could benefit from practical and evidence-based approaches to better connect with their communities to improve health literacy interventions. We've heard time and time again that sometimes doing health related work, health reference, health outreach can be intimidating. And so the goal with this webinar is to make it a little bit less intimidating, lower that barrier, and provide some ideas for how librarians can do this kind of work. And we also believe that health literacy work benefits from sharing multiple perspectives and viewpoints on the topic, which is why we're really excited to have this panel of experts today to talk about their work. So again, the goal is to provide public and school librarians with the information and tools they need to support the health literacy. And we're focusing today on young adults, which is a very understudied area of health literacy. And so we're hoping today that this webinar will kind of fill in some of those gaps. At the conclusion, we hope that you'll be able to identify some ways in which public and school librarians can enhance equity in health literacy, explore opportunities for addressing the health literacy of young adults, and of course, we always want to keep in mind the sustainability of programming. So just to get us started with the topic at hand, Healthy People 2030 distinguishes between two types of health literacy, which you may not all be familiar with. This is kind of a new development in the field of health literacy. So one of them is personal health literacy, and that's kind of probably the more traditional conceptualization of health literacy that we know. So that's the degree to which an individual has the ability to find, understand, and use usually health information and health services. But then there's also been this growing understanding that we also need to acknowledge organizational health literacy. And that's the degree to which organizations equitably enable individuals to do those things we were just talking about. So it's not just, the onus is not just on the person and building their skills, but also making an environment in which people are able to be successful in understanding, finding, and using health information. And both of those will be explored in this presentation, and both present promising opportunities for librarian involvement. So as I mentioned, we have a panel of experts who will be talking about this topic. These are our panelists today. So we have Dr. Leslie Farmer, who's professor at California State University, Long Beach. We also have Jill Kavanaugh, program manager at the Division of Adolescent and Young Adult Medicine at Boston Children's Hospital, and Sean Steidinger, who's the associate librarian for clinical services at the Spencer Eccles Health Sciences Library at the University of Utah. So we can see we have a nice geographic difference here with our presenters today. They all collaborated on a chapter in a book that Dr. Deborah Charbonneau and I just edited called Health Literacy in Library. So all three of them worked together on a chapter on health literacy and young adults, which is really the focus again of today's work. So how it's going to work is we're going to open, each of the panelists here will have a couple of slides to talk about their work. And then we're going to open it up for a Q&A, and there'll be some dialogue. We have some questions ready, but we also would love to hear from you all. If you have come with questions, please feel free to put those in the chat as they go along. And after the panelists share their slides, then Dr. Deborah Charbonneau will be able to facilitate the Q&A session. So I will go ahead and hand it over to Dr. Leslie Farmer, who's our first panelist today.
Great. So we're going to be really starting with the young adults themselves. And we find that as they are looking for health information, that it's usually, for things like, crisis, oh my gosh, family friend has, some kind of disease, or accident, uh, daily life. And it can also be things like, you know, uh, drug use, diet, that kind of thing. Tends not to be focused on preventative or well-being. So it's more like out of need. And especially as, they become adults, romantic relationships, there'll be more things on sex help, parenting, pregnancy, that kind of thing. And for those folks that we might call new adults, so they might be reaching that, 26, year old where their parents can't, cover them for health. They have probably no clue on how to find information as to how they can get health insurance. So in terms of sources, they're kind of in crisis usually. So they're going to try and first look at their friends, their family, experts. Librarians tend not to be really high on that list. And probably part of that is just a lack of knowledge and relationship with those folks. Next is internet, because they can be anonymous, it's convenient, etc. And there's also what we call mediaries or intermediaries. So those could be like peers or neighborhood folks who have gone through this process that they feel comfortable with, and they can kind of give them, some comfort. Um, it's more likely that females more than males will, be looking for information. The more educated the young person is, they're more likely to be, seeking information. Folks who have more money. And part of that has to do with just physical access, to the internet. And non-Latinx tend to, search for information more. Of course, there's a number of barriers. Digital literate, whether it has to do, again, with physical or intellectual access to it. Information illiterate. So young people oftentimes are still have a problem in terms of what are good key words to use, that whole search strategy, being able to identify reputable materials, resources. They probably don't know about like Mayo Clinic and, CDC and those reputable ones. So that kind of fits into that whole health illiteracy. So again, sometimes schools kind of shortchange the health education. And as Emily kind of, hinted at, the idea of just vocabulary of the materials that are available, as well as social norms. So again, like peer stigma, which is actually one reason why they would rather look on the internet rather than talking to somebody. Kind of cultural attitudes about health, like you keep it quiet, you don't take, you just are stoic about it. So those are all things that we need to consider when we're dealing with new adults in terms of how to, help them out. So on the next slide, because I teach teacher librarians, then and used to be a school librarian myself, that's kind of my wheelhouse. So in terms of ways that we can help, folks, the number one is probably the idea of collaborating with teachers and health, specialists. So that could be, your nurse, your psychologist, even your athletic director because of physical aspects of it. Providing those resources, so your collection development and also easy access. So that can be, your library portal, bibliographies, etc. And then, of course, there's the whole issue of instruction. So again, you saw earlier about those barriers. So helping them with, research skills, helping them with being able to have critical, thinking skills, helping them with being able to navigate the internet effectively in terms of media literacy. And I have to say one thing that youth tend to do is they tend to choose websites that are on the front page of whatever your search engine is. And when they look at it, they want something that's pretty, that looks nice. And that tends to be one of the things that they use to decide whether they're going to go on there or not. By the way, they also like to have interactive elements. So those of you that are in development, the more that you can have like polls or like short quizzes, that's really nifty. So besides that, instruction, having just programs themselves that have to do with health literacy, and you might again kind of couch that into things of like body image, etc. And then obviously we want librarians to advocate for health literacy in the school curriculum and making sure that that is addressed. And then good old reference desk, making sure whether to provide referrals to experts, maybe even being able, how do you decide, what health professional to ask for? And then actually collaborating with those experts, not only because of referrals, but also to inform school librarians themselves so they can feel more comfortable in terms of this issue. Thank you.
Thank you so much, Leslie. So now I'm going to turn it over to Jill Kavanaugh.
Hi, everybody. A lot of noise outside. Sorry about that. I'm going to switch gears a little bit and talk about a course that I developed and taught to some youth. I received a National Network of Libraries of Medicine Outreach Award back in 2023, and that allowed me to create this program aimed at teens. As you can see, it's called "Is It Worth the Hype? Navigating Influencer Promotion of Weight Loss and Muscle Building Supplements." So it was really tied in the media literacy and the health literacy aspects. I prepared for teaching this course and designing it by attending a media literacy training course offered between the University of Washington and the Center for Media Literacy. So that was a 1-week course. I then went through and worked with faculty experts from Boston Children's and the Harvard School of Public Health regarding eating disorder prevention. And we created this course, and we ended up teaching. Actually, could we go to the next slide, please? Perfect, thank you. And then the first picture I have up there, great, perfect. So we had background information related to health literacy and how to understand these types of products. Again, they are diet pills, weight loss pills, muscle building products, etc. There are a lot of legislation happening across the U.S. where they're starting to ban the sale of these products to minors under the age of 18. So I worked again with my faculty experts in eating disorders prevention, who helped craft kind of the health literacy aspect of what do we need to know, how can it cause harm to your health, and basically, as you'll see, we then kind of analyzed some social media videos that promoted these types of products. So the next picture I have, so also throughout the course, after we kind of gave that health literacy component and just the background information on these products, I went through misinformation. So I gave a lot of different examples about how influencers online who are promoting diet pills, weight loss supplements, etc., how they use different types of misinformation or disinformation to grab the viewer's attention and to really sell these products to youth. So I went through different types of misinformation and gave a lot of different examples as well. And then the next image is just a little bit about the teaching methods in general. So one thing I learned from attending the Center on Media Literacy's course were the different types of core concepts related to media literacy, and there are 5 of them, and there are a bunch of different key questions. So again, this was all based on a framework established by the Center for Media Literacy. As you can see in the little thumbnail there, what we then did was basically deconstruct 3 different social media posts in which the influencer was promoting these dangerous health products. So in this one, the young person was showing a lot of before and after imagery, links to their, using their Amazon affiliate link to go purchase these products to encourage young people to do so. And then we applied different techniques and really analyzed the content or all the different types of techniques that these media producers use to create this content, to really take a look at what am I being sold? What am I looking at here? And I think one thing I forgot to mention was that this course was offered to teens between the ages of 13 and 24. So we did actually have a 13-year-old, and we did have somebody as old as 24. So it was a very, very group. So again, different levels, different developmental stages, different levels of understanding of social media access. But again, it seemed to really go over well with the entire age range. And then the last picture on this slide is, so after we kind of deconstructed a couple of these social media posts that were promoting these types of harmful products, we then constructed a counter narrative. So it was a hands-on activity where we then used the core principles, and instead of deconstructing, we constructed a video. So we went through like, what kind of counter post would we do for this? So if we were to make a TikTok video, what would our caption be? who would we interview to be part of it? Like, what parts of one of the existing videos would we pull out to kind of challenge or stitch together? So it really was a great kind of activity to promote participation and critical thinking in general. And then next slide. Thank you. Yeah, so then just a little bit about that. So again, it was a very small pilot project. It was a small grant. So we taught 18 kids between the 13 and 24. We did hold focus groups immediately after teaching the course to really get their feedback on what parts of the course were of interest to you. Did you understand the concepts around health literacy, media literacy, digital literacy, just literacy in general? And then 3 months after the course, we sent participants a follow-up survey, and that was really to try to garner information as to whether had they applied any of the principles they had used in this course, had they come across content that reminded them of this course. And it was really great. And there was a lot of the youth, everybody responded to the 3-month follow-up survey, thankfully. And a lot of people are really provided concrete examples of like, oh, I saw a post promoting this product on TikTok, and here's what it made me think of. Or my sister came to me with this product that she saw advertised on Instagram, and I was able to tell her, no, it's actually not. It's a harmful product and whatnot. So it's definitely, again, it has very kind of initial feedback has been positive, but 18 kids is a small sample size, so ideally I would love to reach more kids out there. And then for the last slide I have, just a few takeaways for anybody in the audience. I'd really encourage you to attend a Media Literacy Training Institute, whether it's through the University of Washington or the CML or somewhere else online. There's a lot of webinars, there's a lot of courses, some are paid, some are free. There's a lot of free resources available through the Center on Media Literacy as well. So I definitely would encourage you to get out there and check out what are the established frameworks for teaching kids what they need to know about media and how it's produced and the messages and the biases and everything else that comes into a piece of media. Yeah, encourage everyone to host similar workshops. If anyone is interested, I'm always happy to share my resources or to come in and help teach. If you think you might have a group of young people who'd be interested in attending. It's a very, we make it a very safe space because again, we're talking about issues around body image, weight loss, those sort of things. So I have very clear disclaimers at the beginning to make sure that it is really a safe space for young people to talk about these issues and what they're seeing on social media. And then, yeah, integrating media literacy wherever you can, whether it's into any other health education or advisory programs you have. I always encourage, talk directly with the youth. I spent a lot of time with different teen advisory boards and talking to them and saying, what would you want to learn? What do you think your friends would want to learn? What do your friends have questions about when it comes to social media and health information or misinformation that you're seeing on there? And it's a really great way, and it's to really get at like, what are the teens right now seeing? Because again, they are spending a lot of time on social media and they are being inundated with some good health content, but also a lot of really dangerous health content. And then lastly, there are a lot of different, just my last point, just that, again, as Leslie mentioned, like librarians maybe don't come to mind with teens who are thinking of like, who can I go to for help? So again, I think just kind of encouraging them that, we have these resources, if you don't want to talk about a diet pill, that's fine. You don't have to talk about it with me as a librarian, but here's a website where you can go and learn more about it. So, I mean, it's really kind of like just giving them the opportunity to access these documents, information, et cetera. That's all evidence-based in order to essentially help them improve health outcomes and make better decisions for themselves. So that is my portion.
That was great, Jill. Thank you so much for sharing that example project. I think we're happy to learn more about that. So now I'm going to turn over to Sean, our final panelist.
Hi, my name is Sean Steininger, and in the chapter that I co-authored with Leslie and Jill, I talk about tools for measuring adolescent and young adult health literacy, as well as some interventions and curricula for teaching health literacy that are well suited for this population. And the age range that I'm considering is sort of the tween, the 12 to 25. First, let's consider what we'd want to measure and how we can determine what base levels of health literacy might be in that junior, senior, high school, and college age kiddo group. So there's a couple of models of health literacy that can help us do this, and they overlap a little bit. First, there's the classic Don Nutbeam's model from his 2000 paper, Health Literacy as a Public Health Goal. And this model offers 3 levels or classifications as pictured on the slide. So there's the first level, the basic or functional level of literacy, and that's basic skills in reading and writing to be able to function well enough in everyday situations. Next level would be communicative or interactive literacy. And this is a more advanced cognitive and literacy skill, which combined with social skills enables individuals to engage in daily activities and understand and interpret various types of communication and adapt new information to different situations. And the top level, or critical literacy. This is a combination of cognitive, reading, and social skills, which can be applied to critically think about and reflect on information, and to be able to use this information to respond with greater control over life events and situations, and even achieving policy and organizational change. And the second model that's pictured on my slide there is the Institute of Medicine's often cited report from 2004 entitled Health Literacy, A Prescription to End Confusion. It's a great paper to read. And the authors concluded that health literacy goes beyond the skills of reading, writing, listening, and speaking, and really does include the skills of numeracy. And all of this is wrapped in cultural and conceptual knowledge. And the ones that generated this report, they go on to say that while health literacy measures in current use have spurred research initiatives and valuable insights, they're indicators of reading skills, word recognition, and reading comprehension and numeracy, rather than measuring the full range of skills needed for health literacy, which would be including cultural knowledge, conceptual knowledge, as well as listening, speaking, numeracy, reading, and writing. So now we have an idea of what we might want to measure, and keep in mind that health literacy isn't just a skill or an ability or action, it's also an outcome. And how do we want to measure this outcome? So there's so many scales and assessments and tests to measure health literacy, enough that researchers at Boston University, along with several partners, including the National Library of Medicine, RTI International, which is a philanthropic organization, and a company called Communicate Health, they created a web-based health literacy toolshed database. And this used to be housed at Boston University, but now it's at Tufts University in their servers. And I'm sure we'll be putting that link in chat. It's a really great resource, and it's described as a site that contains information about measures, including their psychometric properties, and it's based on a review of the peer-reviewed literature. And in the book chapter, I mentioned two great measures. One is Realm Teen, which is the rapid estimate of adolescent literacy in medicine. It's a word recognition test that takes about 3 minutes to administer. And another one is eHeals, or the eHealth Literacy Scale. And this measures information-seeking skills or perceived skills of finding, evaluating, and applying electronic health information. And this was validated in a study population of youth that were ages 13 to 21. It's 8 items scored on a 5-point Likert scale, so it's relatively easy to administer. It's been translated into 18 different languages in 26 countries, so it's got a global reach. In addition to these two, the Realm Teen and the eHeals, there are dozens more that are aimed at this adolescent and young adult population. So definitely I recommend checking out the Health Literacy Toolshed for more. So let's say you've measured health literacy levels among your kiddos and you've established a baseline, and now you want to improve their level of health literacy. So how do we go about that? And that will be the next slide. Yes, teaching. All right. Rather than reinventing the wheel, you can adopt or adapt existing programs that are out there, like the one from Nemours called Navigating, and I never pronounce that right, Nemours? Navigating the Healthcare System. And there's another one in Texas called WebLit Legit. That's the two pictures on the slide. So I'll talk about these in greater detail, but first I want to introduce you to the CDC's characteristics of an effective health education curriculum. And it's a list of 15 characteristics that should be considered when developing or implementing a health education curriculum. And although I don't have this on the slide, we'll put a link in the chat to this. And I'll just pull out some of the 15 signs of an effective curriculum. It focuses on clear health goals and related behavioral outcomes. It's research-based and theory-driven. An effective curriculum addresses individual values, attitudes, and beliefs. It addresses social pressures and influences, provides functional health knowledge that's basic, accurate, and directly contributes to health-promoting decisions and behaviors. Another characteristic is that it incorporates learning strategies, teaching methods, and materials that are culturally inclusive. And one more, it includes teacher information plans for professional development that enhances the effectiveness of instruction and student learning. And even though these 15 characteristics are aimed at a health education, this can also be applied to a health literacy curriculum too. So a little bit more about Nemours. Their program is called Navigating the Healthcare System, and it's a 4-unit health literacy program designed by Nemours Children's Health for use with young adults. It's designed to prepare high school and college-age teens to be responsible for managing their own healthcare as they transition into adulthood. Materials are suitable for in-class or in-home use, maybe an after-school program, or in community settings like in a public library. And these can all be taught virtually as well. It's really easy to register and download the lesson plans that come with the slides and the scripts, and it meets the 15 CDC characteristics. And they've also aligned this curriculum with most states' education standards, which is important when you're trying to get a new curriculum passed in a school system. The other curriculum pictured there on the slide is Weblit Legit. And it's described on their website as a toolkit that helps people recognize science-based information from opinion, identify credible sources, and question why the information is being presented, and analyze it if it sounds too good to be true. And there's versions that are aimed at kids, teens, and adults. And the teen version is described as an interactive teen-driven toolkit that empowers teens to discern health information on the internet. And it uses a gamified approach, kind of a truth versus trash workshop format. This toolkit also has downloadable lesson plans and slides, plus there's a Spanish version of the materials. So it's really accessible to a big audience. So now you've got a framework for assessing adolescent and young adult health literacy, a database of measures that you can draw from, and 2 turnkey curricula that you can download and deploy right off the bat. So I hope those are some great takeaways for you. And that's all I have today.
Thank you to all the panelists for sharing your expertise and resources. We wanted to spend some time in just a moment here. We'd really love to hear from you. We'll entertain your questions and comments. But to briefly summarize, this presentation showcases strategies and numerous examples to help expand health literacy work in public and school libraries with a focus on young adults. And again, thank you to the panelists for providing their expert guidance that we can use to assist public and school librarians in connecting with their communities, again, with the goal of addressing health literacy needs in your community. And overall, public and school librarians can explore these ideas further to improve health outcomes and to advance health equity. Next slide. Great. At this point, we would like to open things up and hear from you. Attendees are invited to share any questions or comments in the chat, and we'll get to your comments and questions. Especially, we'd really like to hear how you might apply this information in your current workplace environment. So if you have any ideas as you reflect on some of the examples and resources that were shared today, we'd love to hear from you how you might apply it. So I'll just start with the opening question just to get us started here. And this is for the attendees. What types of community groups can public and school libraries collaborate with to bring health literacy training and services to your community?
I could
Right.
throw some out
So,
there if
right.
that's
So one kind of obvious thing is in your universities, you may well have nursing programs. So getting either the instructors or, especially if you're talking with teens and if you're bringing a program to public or school libraries, is like students that are like recent grads, so that they're closer in age. And in fact, in public libraries, I've also worked in there. Sometimes public libraries will have, say, like a say Friday afternoon, there is a community nurse who will take over like one of the study rooms. And so folks can just walk in and, talk with them. And that nurse can also, work with librarians to point out resources online that would be credible and useful for students.
I was going to add, reach out to your local Department of Health. A lot of times they have educators on staff that are willing to come to your school, come to your community center, your library. And also hospital health systems, they have patient education departments, and a lot of them have a community engagement mandate. So they're looking for partners too, and they might be good to reach out to and come to teach a class or just speak on a topic at various events. And then of course, I gotta put in for medical librarians in hospitals and academic health centers. We're always willing to come and speak and share what we know and help with the teaching of this topic. And maybe cultural health centers that are in your community, they may have a health coordinator. I know that that exists here in Utah. So they may be willing to help with improving these health literacy levels and filling out the curriculum that you have in place.
Yeah, and along with what Sean said, related to hospitals, especially if there's a teaching hospital in your area, a lot of those have groups that do outreach and community activities. For example, at Boston Children's Hospital, we have a group that I also work with called the Center for Young Women's Health, and we create patient education materials at an appropriate literacy level for teens. So we have a whole website, we have an Ask Us feature, and we collaborate with a lot of different people within the Boston community as well as across the country.
And especially for folks that are in their 20s, SSI, Social Security, for folks with disabilities, that's another, useful place. And again, even, so I'm not sure exactly who would be the best ones, but, health, there are sort of like brokers in terms of health insurance. So again, kind of giving, folks some insights into how to choose, that insurance. We should also think about mental health experts as well.
There's a question in the chat about, are there special strategies that you can use for low health literacy with teens?
Sometimes those teens are better at hearing the vocabulary. So, just even showing them, text-to-speech options that are built into computers.
Along those lines, social media. You may be limited in what types of social media you can create, but there are still a lot of other great health providers, mental health providers, clinicians of all types making content aimed at teens that is evidence-based, based on their clinical expertise, and keeps the needs of the patients in mind. So I would, again, Center for Young Women's Health, to plug us again, we do have a great Instagram account where we have health information aimed at young people. And yep, so I would just take a look out there and again, check the credentials, obviously, of anybody who is claiming to be a clinician creating this type of information online, because you want to make sure they are who they are, say they are. But again, if any sort of video content, especially short form video content, is really a great way to get through to teens right now.
There are also tools on the internet to kind of simplify language. And so, and as well as AI can also take text and simplify it. So teaching them that digital literacy skill is another approach.
I was just going to add something on to this as well. I was recently at a conference where a researcher was presenting a poster about TikTok and influencers and financial literacy, which is related to health literacy, not exactly the same thing. But Gen Z is particularly financially conscious, likes to save money. They're doing a great job of saving money early on in life. And so I think if there are ways to hook people in, like we were saying, like how to not waste money on supplements you don't need or insurance that's not the right choice for you, or kind of, I think that age group in particular responds well to ways to not be taken advantage of. And so like empowering kind of messages, like if you're able to use these strategies, you can make the best choices for you and not be sort of duped or something like that is particularly appealing in this group as well.
You can also think about health professionals are also very aware about the issues of health literacy, or just not fluent readers. And so sometimes so they've been very proactive in trying to have materials that are indeed, intellectually accessible. Sometimes if you have a library portal, even providing the resources for English learners is another kind of approach.
Some of the strategies that we have just been discussing, I think, address the second question. What can school and public librarians do to help young adults evaluate health misinformation? Were there any other examples that either the panelists or the attendees would like to contribute or add to what has already been said?
one really obvious thing is just, providing, reference sheets, bibliographies, in your library portal, that are just like, here's a good, place to start if you're looking for health information.
Thank you. And Sean added that Zines and I know comic books are popular ways to teach health literacy.
Mhm. And especially Latina kids really gravitate to photonovelas. That happens to be something that's really popular with that population. And there's some really nice ones these days that give really good practical advice. So again, health professionals are very, aware of, different populations and their needs and interests and what motivates them.
Great, thank you.
And I was just going to say, I love what Jill was talking about too, about inviting people to create something. I think that's a really nice way. In addition to this, how do we help community members identify and evaluate? I think helping them put it into practice and create something is a great way to make it more concrete as well.
Absolutely. So the Instagram content that we create for the Center for Young Women's Health, some of it is actually created by other teams as well. So we work with them. We have a nurse educator on our part of our team. We give them health guides that are, again, written for teens, and they take that information, kind of digest it, and then create a social media post around it. So again, it's really good to get the intended audience involved because they're the ones who are going to make content that's most relevant to this age range.
Another thing is the whole peer mentoring.
Just could say that.
Right. Yeah, mediary. So go ahead and say more about that, Deborah.
Oh, no, that's okay. Thanks, Leslie. I was just thinking about the peer tutors or the peer mentoring, having teens train and educate other teens is an effective approach as well that we've seen in the literature that has been effective.
Yeah.
Okay, so moving on to the third question. What training and support do public and school librarians need to deliver health literacy programs in their communities? We've shared some resources with you today, but we're wondering what else you would need to help build your capacity to support health literacy programs and services.
I know that the National Library, the National Network, let's see, I'm going to think, the NNLM, Network of the National Library of Medicine, has different regions all over the country. And yeah, nnlm.gov, thank you. And there's a certification called CHIS. It is the Consumer Health Information Specialist. And that is a lot of free classes that you can take on the NNLM website or have these being taught in different venues, either online or have a live instructor. A lot of these turnkey programs you can just download from the NNLM. And they're great for sort of teach the teacher, teach how to communicate health information to others. So that's a resource that you could probably take advantage of as a public or school librarian.
And since this is an Emporia webinar, I also have to put in a plug that anybody who takes our health sciences librarianship course or our consumer health information course automatically gets CHIS certification, and it's paid for by the NNLM. And that is the case even if you're not through Emporia. NNLM does do a lot of reimbursement of CHIS expenses, or they just pay it for you. So you can get that certification without having to invest too much money into it. But that's a nice little perk through Emporia. And I know other library schools are doing that as well. I think I saw Sam Nunn on here. She helps with that program. I don't know if, yep, she's still here. So hi, Sam. Sam's really great at getting the CHIS certifications paid for by NNLM.
So I'm actually going to ask a question because I don't know the answer. And that is, like, an obvious support is a nice bibliography of materials on, having to do with health information that is really targeted to teens. So a really good curated list. So who would be a good source for that? Because let's face it, some librarians might not feel really comfortable knowing, like, how is this really, what's the best thing, especially if they have a limited budget, like, here's the top 10 best, books or websites for kids.
I'm putting another one in the chat that I know of. It's called Young Invincibles, and they have a lot of material specifically for young adults, and a lot of it is health related. And they're really creative labels like how to adult and things like that. They're very approachable and well done. So I sometimes plug that with health literacy, health insurance literacy, because they do have insurance materials there too.
Unfortunately, we have to think a little bit about some of the book banning these days because there's kind of like the cautionary, shall we put it this way, about materials that might have to do with any sexual health issues or issues with your body. And sometimes that goes all the way to things like menstruation, you know, like, so just something to be aware of.
I added a link to the chat. It's a website called Got Transition, and it's aimed at that period where the kids are taking charge of their own health, and that can occur at a lot of different ages. It just depends on the maturity of the child, the support that they have around them, on up to young adults that are bouncing off of mom and dad's health insurance. But it's a good site to check out for materials that are aimed at different populations. It could be for the parents, or it could be for the child or the young adult. And it's also got a section aimed at healthcare providers too, for aiding in that transition and helping our kiddos become good health consumers as they grow.
And just one quick note that I'd like to share is that really, if possible, try to find somebody who is an expert or champion in the health topic at hand. So for example, if you're looking for information or teens are looking for information in your school about sexual health or about mental health or about college prep or about test anxiety or just health as a very broad kind of concept, friendships, social relationships, reach out again to, there are a lot of academics, there are a lot of clinicians, there are a lot of mental health practitioners who really have a passion for one specific topic. So I also work with the Strategic Training Initiative for the Prevention of Eating Disorders at Harvard. So obviously a lot of work around disordered eating and eating disorder behaviors. So they bring that expertise in the subject and the health knowledge that these teens need to know. And then you can bring your information science perspective, like here's how to best teach them. Here's what they'll need to know when it comes to digital literacy. Here are the best resources that they can use moving forward. So I think that partnership and that really interdisciplinary approach works really well for librarians.
There's been a lot of really great suggestions in the chat too. I was just trying to save that to my computer. Hopefully everybody else has that option too as well, but there's been a lot of really great suggestions there.
Emily, I think the slideshow stopped.
You want me to put it back up again? Yeah, I wasn't sure since we were.
Yeah, I think we could do that as a wrap up, and that way we can
Mm-hmm.
provide the URL for the book and everyone's
Yeah,
contact information. Thank you.
perfect. Yeah.
So on behalf of the presentation team, we would like to thank you for attending the webinar. We would also like to thank Dr. Vardell for helping to organize the webinar and also to Emporia for hosting it. If you heard something today that sparked your interest by any of the presenters, you might want to check out and further explore the book that was mentioned. All of the presenters today have contributed chapters to the book called Health Literacy in Libraries, and we provided the URL in case you wanted to go check it out. And if you're at a library, you can encourage your library to purchase it. I know that I asked my library system to purchase it as well. So now it's an ebook and I use it in my courses and things like that. Okay, next slide, please. And again, we would like to thank the presenters, all of the panelists that joined us today. Feel free to follow up with any of the panelists. We've included their email addresses if you have any questions and you wanted to reach out to them after the webinar.
And Jill, I was going to ask the curriculum that you developed, is that available? Like, do you have a link to that? Can we view it? I was curious.
It's not publicly available, but
Okay.
I can send it out via email just to take a look. We're still doing a bit of data analysis for the qual portion of the paper, and we're hoping to submit to journals in early 2025.
Oh, wonderful.
I'll just stick around a little bit and monitor the chat just in case there are any final concluding thoughts?
So I'm hoping that someone will put in the chat what they're going to tell their colleagues who couldn't come to this. What are they going to spread to them?
I like that.
Yeah, what's a good takeaway?
And I saw earlier on, Liz Kellermeyer wrote that her hospital has a K-8 school on campus with students with chronic illness, and she's got some ideas for approaching their school librarian. So we had at least one person share earlier. Looks like maybe someone else. Oh yeah, Liz commented again. I'd love to hear if there are any other ideas too.
And the fact that it's being recorded, or we're getting requests that folks indicating they would like to share this webinar link with other people, and that's great. I know that my fellow faculty would love to share it with students in their courses as well. So thank you again to Emporia for hosting it and recording it.
So it literally could be a life-changing, webinar.
Right. Yeah, I was just going to echo again on Andrew asked earlier about misinformation and what's unique to this topic. And I just think, I mean, we spend so much time talking about misinformation, and I think there's not a much more compelling example than health when it comes to misinformation. It's really, if we want to drill down the importance, health really comes to the forefront. So hopefully this webinar's provided some great ideas for how you might go about combating misinformation with a health lens in your library. Well, thank you everyone for attending. I think I'm not seeing additional questions, so we'll bring it to a close. And thank you everyone for the very positive comments in the chat. It was wonderful to have, like I said, there's been so many great ideas and links shared. So make sure I'm going to pause and let everybody save the chat if you'd like on your end. And again, thanks to Emporia for hosting the webinar. And thanks so much to our panelists, to Leslie, Sean, Jill, and Deborah. I really appreciate you all being here and sharing your expertise. I think this has been fantastic. And I learned something new, and I hope everyone else did as well. And I'd like to thank everybody for their time today.
Thank you.
Thank you.